Thank you very much for inviting me to talk here. I'm presenting on behalf of PCCA. I'm Chief of Neurodevelopmental Disorders and Director of the Autism Program at Phoenix Children's Hospital. I have been treating children with autism almost exclusively for the past 15 years, mostly from a biochemical point of view and other medical point of view. And I just like to say that methylcobalamin injections I found is one of the most effective treatments for some children with autism, with some having very um, significant response and significant positive response to the treatment. So today I'll talk a little bit about methylcobalamin treatments um, and for autism spectrum disorder. Um, just my disclosures, several research grants, industry funding, and advisory boards to disclose, and my disclaimer, of course, this is not an FDA-approved treatment when we talk of it as treatment. I have put some key points here, not enough time to go through them all, but in general, what I'd like to talk about is the biochemical pathways that are abnormal in children with autism and how methylcobalamin appears to be very therapeutic in helping fix these pathways, and how when we talk about the double-blind placebo-controlled studies that there was some discussion about, we see that there is evidence in those studies that the children that did have response biochemically did improve their behavior and symptoms. So what we find in children with autism is very interesting. We find abnormalities in these four interconnected pathways. That is problems with methylation, redox metabolism, folate metabolism, and tetrahydrobiopterin metabolism. We find these are all connected, and there's many groups that have studied this, and what I've highlighted in red in this diagram are the metabolites and the enzymes that have been shown to be abnormal in multiple studies from multiple groups, so it's been verified. What I also have here are these green boxes which show us where we can intervene into these biochemical pathways, and we can see that B12 is very key for intervening into methionine synthase. One of the first people to really identify these biochemical abnormalities was Jill James at Arkansas Research Institute, and she was able to find in multiple studies and confirm this, that children with autism had abnormalities in both methylation and redox metabolism, and at that point she suggested it was a subgroup of children with autism. And studies have looked at this data, and there is a nice meta-analysis and systematic review in Free Radical Biology and Medicine for those that are interested, that shows that these abnormalities are repeatable and shown by many groups. What's also been shown is that there's abnormalities in glutathione, the major antioxidant of the body, as a result of these abnormalities in multiple tissues in the body, including the brain. Also, what's been shown is that these redox abnormalities result in oxidative damage to DNA, proteins, and lipids in children with ASD. These abnormalities seem to be pretty pervasive, and recently Dr. Jill James teamed up with Jürgen Hans at the Rosalita Polytechnic Institute, where they used discriminant analysis to ask whether this is a signature of autism, these abnormalities in methylation and oxidative stress. And indeed, they found in their first study that looking at these metabolites of abnormal methylation and oxidative stress, that you can actually discriminate children with autism for those that are typically developing with about a 98% accuracy. So Dr. James was really the first one to show that this simple treatment of injected methylcobalamin 3 times a week and oral folinic acid daily improved these biochemical markers of methylation metabolism and oxidative stress, including improvement in the production of glutathione. In that study, it was an open label study. It was shown that the glutathione redox ratio, which is shown in B, improved in many, but not all of the children. In this study, the Vineland Adaptive Behavior Scale was performed at the beginning and at the end of this 3-month study. We took that data to ask if there was any improvement associated with this treatment, and we found that the change in months in development ranged anywhere from 2 months to 12 months on average, and many skills actually improved anywhere from 6 to 12 months in 3 months of the treatment with methylcobalamin. And these were kids that were not making progress, so wouldn't even be expected to change much on these scales. Of course, this was an open label study, so one of the things that we wanted to see is whether the biochemical changes correlated with the behavioral changes. And we did find that for 6 of the 9 subscales that there was a significant association with improvement in biochemical pathways with improvement in behavior and symptoms. So this is the double-blind placebo-controlled study done by Dr. Robert Hendren, one of the 2 double-blind placebo-controlled studies of methyl B12. This study did not use folinic acid or folate with the methyl B12, which I think could be a significant difference from the previous study. They randomized 57 children. And as mentioned before, there was a significant improvement overall in the Clinical Global Impression Scale improvement at the 0.005 level. The other scales did not show improvement in those that were treated. However, it should be noted that both the social responsiveness scale and the ABC, the Aberrant Behavior Checklist, as just previously noted in this paper by Palmer, are parent-reported scales. And what we found in clinical trials with individuals with autism is that parent-reported scales are very much open to large placebo effects. But one of the things that I think is very important about the Hendren study, even though not all of the outcomes were positive, is that the change in the CGI, the Clinical Global Impression Scale, was correlated with improvements in the methylation capacity, that is the SAM-SAR ratio. So again, improvements in the biochemical pathways were correlated with improvements in the Clinical Global Impression Scale. This was also true of the previous double-blind placebo-controlled study, where overall there was no significant effects, but in a subgroup that did improve, there were biochemical changes. One of the things that we know about children with autism is that the disorder is very heterogeneous, and that there may be certain subgroups that respond to certain treatments and have certain etiologies. So it's very important to understand when you're looking at autism spectrum disorder that there are many subgroups that we have to find that will respond to different treatments most likely. And I believe that the studies that we've shown here suggest that there may be this subgroup, which may be significant, that responds to methyl B12. Overall, the clinical studies, again, there's 2 double-blind placebo-controlled studies, there's 2 prospective open-label studies, and there's several case reports. All of them show improvement in ASD symptoms. Again, the double-blind placebo-controlled studies and one of the open-label studies show that these improvements are correlated with changes in biochemistry, and there was few adverse effects, and when they occurred, they were very mild. How does B12 work? Well, we talked about improving function of these biochemical pathways, particularly to improve methylation and glutathione production. But one of the other ways that we know that improving this pathway helps the brain is that glutathione is made of glutamate. And one of the things that is a theme in autism is there's too much hyperexcitability and too much glutamate in the brain of children with autism. And by reducing glutamate, you can rebalance the excitatory-inhibitory ratio. Other evidence from this study, for example, by Jill James, demonstrated that there are certain polymorphisms that are associated with autism within these pathways, particularly the transcobalamin B12 binding protein. And if an individual has a polymorphism in the B12 binding protein and in COMT, they are at significant risk for having autism with an odds ratio of 7. There has also been case reports or case series of 4 patients with a novel TCN2 mutation. This is the B12 binding protein, and 2 of them had autism. Interestingly, in these cases of children with autism, when they were treated with cytocobalamin, they actually developed acute anemia, which was only improved when they were given methylcobalamin. And methylcobalamin was shown to improve their symptoms. Also, there's evidence of decreased levels of B12 in the brain of children with autism. Methylcobalamin in particular was 3.1 times lower in the brain of individuals with autism as compared to controls. We also find that the biochemical abnormalities that would be associated with a decrease in B12 and has been also found in individuals with autism were also found in the brain, including changes in methylation and glutathione metabolism. In addition, we find that there's decreased expression of the mRNA from thymine synthase in the cerebral cortex of those with autism, and then it decreases much faster with age than typically developing populations. Also, there is evidence that dietarily there is lower B12 intake in children with autism spectrum disorder, as shown in this meta-analysis. And this is another letter that you did see, which I'll highlight, from the Medical Academy of Special Needs president, that states that this is a treatment that is considered standard of care for children with autism through their training program, and they find that it's extremely effective. This is an organization of over 1,000 physicians that treat children with autism. And I would say that one of the problems with getting funding, I am an academic researcher and trying to get funding for researching B12. And one of the comments on 2 of the grants that were not funded were that methylcobalamin was standard of care and widely used. So it wasn't seen to be novel to actually fund for further clinical research because it was already something that was already widely used. And with that, I will thank you for giving me the time to present this to you.
Thank you, Dr. Frye. We will now take clarifying questions for nominated presenters. Please use the raise hand icon to indicate that you have a question, and remember to clear the icon after you have asked your question. When acknowledged, please remember to state your name for the record before you speak and direct your question to a specific presenter if you can. If you wish for a specific slide to be displayed, please let us know the slide number if possible. Finally, it would be helpful to acknowledge the end of your question with a thank you and the end of your follow-up question with "that is all for my questions," so we can move on to the next panel member. I would actually like to start the questions, and I do see we have other interested panel members as well. This question is for you, Dr. Frye, if you could answer. You have stated that the downsides, shall we say, of vitamin B12 injections are minimal, and that there are no real known side effects. I'm curious as to your view on the 2010 paper by Geyer, an autism cohort study, where they found cobalt levels following vitamin B12 injections were significantly high. And just to stress, the dose was 75 micrograms per kilogram, and what they summarize over here is that methylcobalamin injections significantly increased the mean levels of plasma cobalt 6.83-fold and urinary cobalt 51-fold in comparison to unexposed subjects, and significant positive correlations were found between the frequency of methylcobalamin injections and the levels of plasma and urinary cobalt. And our concern, of course, being that cobalt toxicity affects the heart and a few other things, but the cardiomyopathy. I'd also, as a follow-up, like to clarify on the Dr. Day presented that one patient with an MI where it was considered not related to the methylcobalamin. So we'll start with Dr. Frye, if you could comment on that study and your thoughts on the cobalt toxicity with injectables.
So again, I have patients that have been on methylcobalamin injections for long periods of time, and I have not seen any toxic effects that would be linked to cobalt. Although I understand your concern. The fact that there's elevated levels, and sometimes we see even elevated levels of B12 in the blood. And we actually found this was linked to something called the folate receptor autoantibody in one of our studies. So one of the things that we take as a kind of an overarching notion is that the children with autism have metabolic systems that are under stress, so they need higher levels of these vitamins for those systems to work properly. So the fact that they're elevated in the blood just in general is not concerning, because we're treating a disorder, and the levels may not, for normal individuals, may not be relevant as much to individuals with autism. That is, for example, one of the other areas that we've made a lot of progress in is that we find that folate has trouble getting into the brain, and we know that the mechanisms behind this, and one of the things that we can do is increase folate levels in the blood to actually push the folate through the reduced folate carrier into the brain and restore levels. And this has been measured.
Dr. Frye, I apologize for interrupting, but my question was very specific to cobalt toxicity and increased cobalt levels with 75 micrograms per kilogram of vitamin B12 being injected. And I'm summarizing that your response was that you have anecdotally not seen this in the study, in the patients that you've treated per se, but that you would also be concerned that cobalt toxicity could be a possibility?
I think that it's something of further study, but I don't see any evidence that it seems to be harmful to my patients. In fact, I see many positive effects, and when we stop the B12 injections, as sometimes we do, to see if they're necessary, after a certain amount of treatment, you find that children start to lose skills. They feel tired. They regress a bit. So it seems like the treatment seems to give them more benefit than side effects. And I have not seen any side effects of cobalt. Although, being an academician, I would think that anything's important to study, because, that's something that, we have a question about. So, I think the question is very insightful and valid, but I don't see, and I haven't heard from any of my colleagues, this concern or any symptoms that would make me think that there's cobalt toxicity.
Thank you, Dr. Frye. So just to summarize my read on this study, which included 72 patients, so it was not larger than some of the other studies presented so far on the benefits. The other question was, there was a paper that I would appreciate your comment on, which was on speech disorders in autism patients, and they reviewed multiple substances that could help in that arena, and it's a summary report that was done. I apologize, I'm going to pull the reference up for you in just a second. But essentially, that paper on speech disorders, which reviewed multiple substances, close to 12, that could help patients with autism spectrum disorder, summarized that the oral formulations were safe and effective, which seems contrary to what we've just heard, where oral formulations of drugs are less useful in autism spectrum disorder. So I would appreciate your view on the fact that there's a published review with multiple other experts who seem to feel like oral formulations are safe, and that anything else would require larger clinical studies to ensure safe and efficacious dosage, which is similar to the cobalt side effect study, which also states that larger studies are required to establish the safe dosage of intravenous methylcobalamin.
Okay. Well, first, this isn't intravenous. This is subcutaneous.
Subcutaneous.
So, yeah. So if the study, the cobalt study, was intravenous, that would definitely be a difference. But the studies that have used methylcobalamin orally have all been combined with other supplements, and they do show that there is some benefit overall of of multivitamins that include cobalamin. However, I would caution that many children with autism don't tolerate oral. First of all, anything oral. They are very restricted, so we can't give them anything oral. And two, many children have severe GI problems, including inflammation in the gut, which may limit the ability to absorb B12 and to produce intrinsic factor, probably. So they may not be absorbing it if we give it, orally. And just in general, what's associated with autism is severe food restriction. So we need these other compounds injected in other formulations so that these substances can be given to children with autism and they can receive it. And I have that issue with many patients.
Thank you. I do appreciate your difficulty as an academician in obtaining research funding for this. That said, it appears that at least a few papers in this arena all call for larger translational medicine studies to be performed, so safe new protocols to treat these ASD-mediated disabilities can be introduced. Would you agree that there is a need for controlled studies and a larger scale?
I do. Oh, most definitely. And that's what, we're currently doing with, leucovorin right now, because it seems to be so helpful for some children. We have gained funding for doing multiple multi-center clinical trials, and I completely agree that that would be great. The problem is to a practical matter, this area of research in autism is very underfunded, and I don't know that people realize how underfunded and how much impact we could make if we were able to research these substances. And just briefly, one of the comments of the first grant I submitted was your exact questions about the oral form of the and whether it was superior, that is injected versus superior. And so in the second grant, we actually included a separate arm that included the oral form of methyl B12. And I think the reviewers were a little bit confused on the non-inferiority analysis, and it was a little bit too complex for them at that point. You know, that with the idea that, you know, they thought this was kind of standard of care, I think was prevented us from getting funding.
Dr. Frye, thank you very much for your detailed answers. Much appreciated. With that, I would like to request Dr. Wada to speak on his questions.
Yes, thank you very much. And thank you, Dr. Day and Dr. Frye, for those presentations. I just have a quick question. It seems the FDA did have an issue with lack of reports on safety. And unfortunately, that's because the 503As don't have to report adverse events, yet it seems like the drug is drugs being compounded. First, for Dr. Day, you said there was 27,000 patients that were treated with 0.1 ml. The other question that the FDA had was the range of doses. So for both of you, what was the common dose with those 23,000 or 27,000 patients? Or do you know?
This is AJ Day. The most common concentration of the compound is going to be 25 milligrams per ml with a dose of 0.1 ml per dose. That is most common. There are going to be some interpatient variabilities, and Dr. Frye and as well as our speaker in the open public hearing, I believe, will address some of those as well. Dr. Frye?
Yes, I think that that you're absolutely correct. It is very variable, and that's a real area where we need to study more. The clinical trials used anywhere from about 60 to 75 micrograms per kilogram. But I find in my clinical practice that it varies considerably, and many times you have to titrate the dosing anywhere from about will be 1,500 to probably 3,000 micrograms every other day to every 3 days as far as injectables.
All right, thank you. No further questions.
Thank you. Dr. Gora?
Thank you. This question is directed to Dr. Frye. First, excellent overview of the situation. My question is, with the fact that there are products available from Japan and Australia, are you aware of any attempts of anybody trying to import them to do studies rather than using a compounded product? And is there any sort of registry for autistic patients to record their responses to therapy so we can get that data that was asked about common doses and adverse events? Thank you.
Yeah, that's such a great question. No, I'm not aware of anybody trying to get the formulations from outside the States. And the question about the registry is very very good. There's been several attempts and several, what we would say, surveys of the use of certain treatments in autism to see which ones seem to be the most effective with the least side effects. And they have shown, and they've all pointed to methyl B12 as being one of the most effective treatments with the lowest amount of side effects. Right now, we're working on a national survey that Dr. Jim Adams did with I believe about somewhere between 5,000 respondents. And we found that for children that were on methyl B12 injectables, they had a significant improvement over time in the parent-rated severity of their disorder compared to children that didn't take that treatment. And it was perceived, it's one of the treatments that were perceived as most effective by parents. Of course, this is all most of these surveys are retrospective, which is, unfortunate because, there's limitations in that type of research. And unfortunately, there's no prospective registry. At this point, I know that there's several groups, including Autism Speaks, who is trying to develop a network where we standardize the way we see patients, so at least clinically we can record their improvements over time, as well as any types of changes that they may have received from therapies, both positives and negatives.
Thank you. No further questions.
Thank you. We will now begin the open public hearing